Hey everybody, welcome back to Ortho Nugs. In this video, we're going to share a clip from a recent lab session where we discussed and also demonstrated the posterior lateral approach to first rib mobilization. So check it out. Okay, can you hold that there, please? All right, so hold that right there, please. Okay. All right, you can hold it like right there. All right, so you've got a couple different options for first rib mobilization. So this is the costoclavicular space right in here, right? So we need to try, in theory, to try to increase the amount of room for that neurovascular bundle. So one thing, we need to make sure that the clavicle is adequately mobile. We also have to make sure that there's adequate rib mobility. So we're going to do an inferior mobilization on the first rib. There are some resources that talk about more of an anterior approach, so applying pressure on this anterior lateral aspect of the first rib. I tend to find that patients tend to find that pretty uncomfortable because don't forget you have this neurovascular bundle that's running right through here. So I take more of a posterior approach. And the way I do that is if you cradle the neck and then I slide, first I'm gonna have to sink through the upper trap, the soft tissue. That first stop I feel, there's really nothing else back here. That has to be the first rib. So I'll make contact with the first rib with my second MCP, the lateral aspect of my proximal phalanx, my second digit. So sink through the soft tissue, the first stop, I'm on the first rib. Then I'm gonna ramp up the force, apply more pressure, and assess that R2 or that tissue barrier. And then I can try that on the other side. Oh, we're stuck.
We're stuck.
All right, thank you. So now let's try that. All right, so same thing, I'm gonna cradle your neck, slide, slide, slide. So I'm hitting her upper trap there. Slide, slide, slide. Now I've hit the first rib, I feel that resistance, and then I can go a little bit further and spring against the barrier. So this is just my joint play assessment. I can assess the other side as well. If I'm going to treat, rib is there, push a little more, I'm at the barrier, and then I can do oscillatory mobs, maybe more of a Maitland grade 3, a little more aggressive, lower amplitude, Maitland grade 4. If you're finding that you're having a hard time sinking through the upper trap soft tissue, there's adaptive shortening, there's hypertonicity. One trick is you can put their head and neck in an ipsilateral lateral flexion or ipsilateral side bent position. That'll put the upper trap on slack, and then you might have an easier time sinking through the soft tissue and getting to the first rib.
What are you thinking?